Hi everyone, my name is Destiny and I'm an occupational therapist here at Glory to God PPEC. Today we're going to be going over a very common diagnosis that many people generally do not understand. Cerebral palsy, as the name implies, cerebral has to do with the brain and palsy has to do with weakness or problems with muscular function. We can now conclude that cerebral palsy is a problem with motor function that is caused by an issue with the brain. These limitations affect a child's ability to participate in age-appropriate functional activities. We're going to talk about how some of these upper extremity muscular issues can be addressed through occupational therapy. Splints may be commonly used as a therapeutic modality to assist with a child's ability to participate in these functional and meaningful activities. Splints, also known as orthoses, are removable external devices designed to support a weak or ineffective joint or muscle. Splints can help to improve the hand and arm function of children with cerebral palsy and brain injury through correcting or preventing deformity, providing a base of support, and facilitating training and skills. In this video, I'll be going over the 3 most common types of hand and arm splints that we use here at Glory to God PPEC. But please keep in mind that there are many other splints that your child may benefit from. A resting hand splint is recommended to keep your child's hand in an open position. This position is with the fingers open and the thumb out of the palm. This is the opposite position of a fisted hand. Many children who have cerebral palsy experience spasticity or hypotonicity in their muscles. Spasticity is when a muscle tightens involuntarily and is stiff. Spasticity is observed when a child keeps his or her hands in a fisted position. A resting hand splint can be beneficial if your child's hand is not tightly fisted but still has some mild stiffness. Typically, it is recommended that a child wear this type of splint at night to provide a prolonged stretch for about 6 to 8 hours. This can reduce the amount of stiffness, prevent the muscles from shortening, and can prevent contractures from developing. This is Destiny. She has cerebral palsy, and as you can see, both of her hands are tightly fisted and her wrist is flexed as well. She has a lot of tone, also known as hypertonicity. You can see I'm trying to gently open her hands, but they quickly go back into a closed position. Here you can see that Destiny is wearing a resting hand splint on both of her hands. This splint is helping to keep her hand in an open position. Her fingers are open and her thumb is no longer curled into her palm. This splint is helping to prevent contractures and providing a gentle stretch to promote joint integrity. The next type of splint I'm going to go over is called the elbow immobilizers. A child with cerebral palsy may have difficulty with extending his or her arms due to high tone, also known as hypertonicity. The elbow immobilizer splint can help your child keep their arms in extension and assist them in weight-bearing activities to strengthen his or her shoulders. The elbow immobilizers provide firm immobilization while still allowing use of the hands. As a secondary use, the elbow immobilizer splint can be used to prevent a child from sticking his or her hands in their mouth. This is Javier. He has congenital anomalies of the brain. Javier has very low tone, also known as hypotonicity. In this clip, you can see that Javier's arms are very flexible. He can bend them behind his neck and back without any noticeable discomfort. His arm movements appear to be somewhat floppy and uncontrolled. He has difficulty maintaining good posture when sitting. He has a hard time keeping his arms in extension. You can also see that he continuously puts his hands in his mouth. Here, Javier is wearing elbow immobilizers on both of his arms. These splints are giving him firm immobilization, which is allowing him to engage in weight-bearing activities to strengthen his shoulders and improve his tone. As a secondary benefit, these splints are not allowing him to put his hands in his mouth anymore. A thumb spica splint is recommended to allow a child to have a more successful and functional grasp. Oftentimes, a child who has cerebral palsy or a brain injury have a weak thumb, and they tend to maintain their thumb touching their palm, which is also known as adduction, and experience difficulty holding their thumb away from their palm, which is known as abduction. A thumb spica splint allows for more thumb web space, and opposition, which is when your thumb and your pinky touch, which allows for a more functional position. It stabilizes the thumb outside of the palm so that the child can concentrate on moving his or her fingers to pick up objects. The splint provides light compression and it cushions the thenar eminence and reduces joint play. The splint is designed to be used during the day when support is needed and when you do things with your hands. A thumb spica splint can be made like the resting hand splint with a hard plastic material, or it can be ordered in a soft neoprene material. This is Juan. He has cerebral palsy. Here you can see his thumb is in adduction, so touching his palm, and he is having a hard time holding his thumb in abduction, meaning away from his palm. You can see he continues to try and grab the peg using his thumb and his index finger. However, he is unsuccessful. He is unable to complete any functional tasks with his hands at this time. Juan is now wearing thumb spica splints on both of his hands. His thumb is now stabilized and in abduction, and he has more thumb web space, which makes it a lot easier for him to attain a functional grasp. He is now able to grasp the peg using his thumb and his index finger with minimal difficulty. He can now participate in functional tasks using his hands. At the end of this clip, you can see he is able to place the peg onto the pegboard successfully. As with most orthotics or splints, it is recommended that you initially wear the splint for 20-minute intervals just to make sure that there is no irritation or redness in the underlying skin. This is particularly important if you're ordering this for a child who may not be able to verbally communicate discomfort. Within a day or two, you should be able to wear the splint for up to 2-hour intervals. You want to check the skin for redness every time you remove the splint. If the skin becomes red or sore around the edge of the splint, you may add padding to the edges with a soft material such as moleskin, or you can use tape to cover the edges. Now, when it comes to cleaning the splints, you want to make sure you clean it daily. You can use a damp cloth with mild soap and warm water, or you can use rubbing alcohol to disinfect it. Make sure to pat the splint dry with a towel and then air dry it completely before reapplying. Thank you for watching. Stay tuned for more occupational therapy videos from Glory to God PPEC. We will be posting every last week of the month. Have a blessed day. Bye.